Hi, friends. Thank you so much for the chance to join you this way, virtually and by pre recording. I will tell you that nothing but the most significant alternative commitments could have possibly kept me away from this wonderful meeting. I am sorry to miss it, and I look forward to the successor meetings. I want to begin with my thanks to so many people, but most especially Victor Zhao. Victor's vision, his constancy, his courage in bringing together this Action Collaborative and other National Academy activities on decarbonization of healthcare and climate change is just the kind of leadership we need to turn the corner on this existential threat to humanity. Victor, thank you for what you're doing. I want to also give special thanks to our co-chairs, people of enormous gravitas and background. The fact you're willing to take your personal reputations and visibility into leadership of this effort is an incredibly important factor for success. Thank you for doing that. To all my National Academy colleagues and staff, and to the participants in this event, I wish I could be with you in person. We are seeking large and urgent change. The threats of climate change are now imminent, present, and with us, and extremely serious. I only have a few minutes with you, and I'm not going to spend that time reciting the degree and nature of the threat. If you need to be reminded, pick up the morning paper or get onto the website you like, and you will read today another consequence of climate change taking human lives and potential from our planet. Read the scientific literature to understand how serious that will get and what further threats lie ahead. This is an existential threat to humanity. Nor will I spend but a minute reciting the evidence we have on the role of the healthcare sector in this problem and the potential it has for mitigation, both through resilience and adaptation and reduction of greenhouse gas emissions. We are 8.5% of the problem in this country, and so we have a role to play. The track record so far for the collaborative work that Victor has induced in the Academy has set a scientific foundation in place that is accessible to you should you need further reminders. The National Academies, and the National Academy of Medicine in particular, is inviting healthcare organizations to be players, to be part of the answer. And that's what I want to talk about. What is it going to take? I want to turn to the guidance I received from my most important mentor in my entire career, Tom Nolan, the best expert in improvement I ever met, a generous and wise man who unfortunately passed away just a few years ago, far too soon. Tom once asked the question, what does it take for large-scale change to occur? And his elegant answer was these three factors. He called them will, ideas, and execution. For any change, it takes first an intention to disable, to give up on the status quo, and to establish an attractive future. It takes ideas for change. What is the new system, the new model, the new ideas to bring into place to replace the status quo? And then finally, it takes the day-to-day attention of the individual or leader, depending on the kind of change involved. If I want to learn Spanish, I need the will to do so, a reason to do so. I need approaches to learning, which in the modern era can be many, pluralistic, and then I need to do the work, the day-to-day work. If I want to improve patient safety, the same applies. I will need to intend to improve patient safety as an organization, as a board of trustees, as an individual clinician. I will need to know how to do that. What are the ways in which safety can be improved other than just yelling at people? And then I'll need the day-to-day work, the hard work of attention in normal activities. And if we want to end the threat of climate change At a global scale, we will need will, the intention to do so, a reason to do so, a belief that we must do so. We will need ideas. We'll need to know how do we decrease greenhouse gas emissions and adopt resilient postures. And then we will need to attend to it day to day. The work that we do has to center on the change. In the case of climate change, we should have each of these in abundance. The threat is existential. The ideas are very well developed and available to us. And this is work now that needs to be mapped into our daily work. It sounds easy, but it's not easy. And I want to spend the time I have with you to explore why it's so difficult. No, I don't claim to have the answers. I don't know. What I do know is we're not making progress at anything like the pace we need. We, meaning humanity as a whole, individual sectors and healthcare in particular. I think the problem is that this is a classical issue of collective action. The only solutions that really will work to save the planet are solutions in which everyone participates, but in which paradoxically no one actor matters very much. This is the logic explored by Garrett Hardin in his extremely important paper, The Tragedy of the Commons. When the problem is one of collective action, individual logic, individual reason makes you a bystander. It really doesn't matter what you as an individual do when it comes to solving problems of collective action, like voting, for example. That's because it takes us all, but no one in particular can solve the problem. Hardin pointed out that rational self-interest leads to inaction, in which each individual pursuing their individual self-interest rationally would not participate in the creation of a solution. In Garrett Hardin's analogy, the commons is destroyed as each individual takes advantage of the commons because they as an individual don't matter very much. This tragedy of individual inaction when the solution requires collective action needs remedy. And it needs it badly in this arena of climate change, and in particular with respect to healthcare's activities in this arena. What do we do about it? What do we do to get the collective action that we needed in place? Well, there are several options. One is collective coercion, using government, rules, laws, enforcement to force action when rational individual behavior would lead to inaction. That's why we have many laws which require us to act in a responsible way, even though logically our individual irresponsibility wouldn't make a difference. No one really likes that. I think our more primitive reactions are induced by the suggestion that we be coerced into participation. You know, you're not the boss of me, say my young grandchildren. We complain, we whine about unfunded mandates. You're asking me to do something, but you're not paying me to do it. I will point out editorially here that the unfunded mandate to decarbonize is coming from nature. And nature is not an awfully willing conversationalist when we claim that the demand is unfunded. Other reactions to collective coercive methods are self-justification, excuses. I'm different. I shouldn't need to participate. It doesn't. You're being unfair to me. There is a individual aversion to accountability, an aversion to metrics or to transparency, as each of us acts from our individual interests instead of understanding our role in the collective. It may be that in the solution to the climate problem, collective coercion, government action, rules, laws is our only way. And I certainly would endorse those because if we can't muster the commitments and activities as individuals voluntarily, then it threatens the planet not to create contingencies which require us to act. But it's a tough game. Another approach is interesting. It's culture shift. Today, if you drive through the streets of my town, you will see on every curb on Tuesday morning a recycling bin. That wasn't true 15 years ago. Now recycling has become, at least in communities like that, the thing to do. Everybody does it. It's how we act here. Can I explain why there were no bins 15 or 20 years ago and they're absolutely everywhere now? No, I can't. But I do know that something has happened to change the cultural norms so that now it's the thing to do. We all do it. Professionalism creates norms like that in which culture shift is possible and everybody participates. Is that the way we should approach decarbonization and climate change in healthcare and elsewhere? I don't know. I hope we could achieve that. It hasn't happened yet by any means. And it's slow and the clock is ticking. And I don't know if we have the time left to rely on this gradual culture shift to achieve the decarbonization we must. A third option is incentives. If you want something, you pay for it. You buy the action. And so we create a business case or a lucrative opportunity in participation in decarbonization. It works. It can be extremely costly, and it has the problem that it actually makes defection even more attractive. If you can hold out, maybe the price will go up and you'll make even more money, be paid even more to participate. This is the approach taken by Nye Bevan as he founded the National Health Service in the UK. He was asked, well, how did you win over the support of the specialists, the physicians who were resistant to the idea of a National Health Service? And Bevan's famous answer was, we lined their mouths with gold. So one possible option to get the decarbonization we need is just to pay people to do it. I don't personally believe that's a very smart option. First of all, everyone needs to be engaged, and the potential costs are absolutely phenomenal. And I doubt the durability of participation in which the participation is bought. But that leaves one other option, which I'll call voluntary collective action, something happening among us in which we all decide to join in as a collective with action together in a concerted and directed way through some kind of collaborative spirit. I have seen this work. The most thrilling episode in my entire career of working on improvement was the 100,000 Lives campaign, 2004 to 2006. I won't give you the extensive history there, but basically the safety movement had begun to mature, but we weren't seeing a lot of activity in patient safety kind of distributed around the entire industry in the United States. And my colleagues and I in the Institute for Healthcare Improvement decided to kind of copy the structures and logic of a political campaign and set up a campaign for saving 100,000 lives. This was all back of the envelope stuff. We were criticized by some academic organizations for not being more disciplined about our goals and our methods and our metrics. But we knew that was resident in the hearts of the healthcare workforce a true intention to try to make things safer. And we thought we would just issue the invitation. The invitation was to have you and your organization join in a national campaign to save 100,000 lives in 18 months through the implementation of 6 evidence-based changes in care. The response was massive, moving, and for me, catalytic. It changed the whole way I think about large-scale change. The details of the campaign design are well documented, and in other venues, I'm happy to share them with you. But it was basically an invitational idea in which we created a platform, the 6 changes. We created a communication system in which that information was available to anyone, anywhere, anytime for free. We created a kind of structure of relationships. We call them nodes, in which everyone could find other people in their organization, in their area, in their discipline, who wanted to work on this together, and they came together. We set up a measurement system in which we urged people to be transparent, to say what they were doing, to say what they were accomplishing, to tell about their failures so we could learn from them. The response was electrifying. By 18 months of that effort, we had 3,100 hospitals enrolled and active. 85% of the hospital beds in America were participating, and not a nickel changed hands. There was no payment, no incentive, no requirement, nothing going on except this invitational environment. This picture is on the wall of my office. It is a picture taken in Madison, Wisconsin. We had our team travel across the country and stop in 15 cities to have kind of rallies for the 100,000 Lives campaign. And in this case, the leaders in Madison, Wisconsin decided to come together and show us what they were going to do. This picture is taken in Badger Stadium. And if you look in the background, you'll see yellow balloons. Those yellow balloons outlined 1,500 seats in Badger Stadium. And that was what the leaders of the healthcare systems in Madison, Wisconsin said would be their goal, to save 1,500 lives, their share of the 100,000 Lives campaign in that 18 months. When I first saw this picture, it literally brought me to tears, that this much intrinsic motivation, this much commitment lies within the healthcare workforce. So I've seen it happen. I've seen voluntary collaboration produce a lot of activity. And I think underlying the structures of the National Academy Collaborative is a hope that this kind of collective activity, voluntary collective activity, can be ignited. Can it be? I frankly don't know. It hasn't yet been. We have many promising words and many passionate speeches, but not yet the action and the measured results that we need in order to save the planet, or more exactly, to do our share, our 8.5% share in saving the greenhouse gas emissions of this country. And the clock is ticking. Read the morning paper. I imagine that I could meet 50 years from now with my 8 grandchildren, who will then be in their 50s, and ask them what they'd like to talk about. That'll depend in part of the environment that they'd be in. Will they be celebrating the success of saving the planet, sustainability? Will they be lamenting the disasters that have occurred as climate change has taken over humanity? Storms, sea level rise, climate refugees, climate wars, famine, water shortages. I don't know what they'll say, but I know what they'll ask, which is, Papa, which is what they call me. Where were you? What were you doing in helping to shape the future? What will I answer? I'm sorry, I was too busy. There were many other things going on, and I couldn't pay attention to this. It was an unfunded mandate. We didn't have a business case for saving the planet. I didn't matter. The little I could do wouldn't actually change fate. What will I answer my grandchildren 50 years from now as they ask me about what I did? I think the answer I want to be able to give them is, I was there. I did it. And for everybody on this call, listening to me, and everyone at this conference, I think there is a list of activities which reflect commitment in action, whether it be voluntary, which I hope it can be, or required by government action. This is what you must do. Each individual, each organization, each department, each board of trustees, join, become an active player. The sidelines need to be empty and the playing field full. And although you can, it's the nature of a collective action problem. You can be a defector. You can be a sideliner. You can be a free rider. Don't do that. Establish board oversight. Oversight from governance is the only way that we're going to be able to recruit total organizational participation in the kind of stuff that needs to be done now, not later, now. Stop complaining. The excuses about mandates and costs and business case won't do the job. Nature is unforgiving. She does not care about the discomfort that we have to go through in order to stop the global warming. And the time for resistance, the time for complaining, it's over. And then do this together. Victor and the academies have set the table for collaborative action, just like the 100,000 Lives campaign. And they're not alone. There are others, Healthcare Without Harm and many other organizations trying to help us not feel lonely in this. And we will be far more successful if we do this together in all of our venues of association and collective action. Measure and report greenhouse gas emissions, especially. There has been strong resistance, even in this collaborative, to public reporting and transparency about emissions, but it's the only thing that counts. And I think the measure of steps towards success here will pivot on the moment in which each of you decides to become part of the transparent structure in which we're reporting on our emissions, good or bad news, and learning from what we can find out from looking at those measures. Let's get transparent. And then hold each other accountable. In collective action problems, there need to be mechanisms of voluntary enforcement. The Nobel Prize winner, Elinor Ostrom, and her amazing studies of successful collective action, talks about the creation of consequences for defectors. You can let the government do that with fines and laws, or you can do it in a sociology in which not participating actively in greenhouse gas reduction becomes sociologically unacceptable. Hold each other accountable. And then unleash the intrinsic motivation of your staff. I don't think there is a goal more charismatic, more ready to be adopted by the people that work in healthcare than this one. And so build on that intrinsic motivation and make your way towards success. I thank you for the chance to share these thoughts with you. Inaction is no longer acceptable. And one way or another, we have to find the discipline to act together, even though, paradoxically, the action of any one of us is of only tiny marginal contribution. The National Academy of Medicine has set for you a platform in place, a community, a support system, immense resources. This is the time to harness them and make the changes we need, the measured changes, the measured reductions in greenhouse gas emissions that are now possible with sufficient will, ideas, and execution. Thank you very much and have a wonderful conference.
Don, thank you. Profound words, ones we need to internalize and act on. Don knows from what he speaks.